You're watching News Channel 11 at 6.
5 Northeast Tennessee counties soon could see additional funds for addiction resources. That's if a settlement with a major opioid manufacturer stands. Good evening, I'm Josh Smith.
And I'm Sarah Diamond. Purdue Pharma recently filed for bankruptcy just days after reaching a tentative multi-billion-dollar settlement. That deal could put to rest 2,600 lawsuits by state and local governments across the country. Jackie DeFusco asked a Tri-Cities attorney who is representing 5 local counties what is next.
Josh, Sarah, the local attorney I spoke to says he hopes this tentative Purdue Pharma settlement will encourage other manufacturers and distributors also facing lawsuits to pay back communities hardest hit by the opioid epidemic. Johnson City Attorney Thomas Jesse is part of a group representing more than 500 counties and cities in lawsuits against opioid distributors and manufacturers like Purdue Pharma.
I think everybody knows they made the pills. It's kind of hard to dodge the fact that they're responsible.
Purdue recently filed for bankruptcy just days after reaching a tentative multi-billion-dollar settlement that doesn't include an admission of wrongdoing. Still,
I think it does stop the companies from having to spend all the money defending.
If the settlement stands, Jesse says each county can still choose to take their case to trial, or they can have a say in determining their share of funds over the next 10 to 12 months.
We felt the best recipient of the damage money would be the people closest to the problem. It is a local problem that needs a local solution.
A database mapping the flow of oxycodone across the country shows between 2006 and 2012, tens of millions of pills flowed into the 5 Northeast Tennessee counties Jesse is representing. He says money from the Purdue settlement will be used to bolster resources burdened by the opioid epidemic.
We have a bunch of great tools that we know work. We just need to expand the use of them, and we need funding to do that.
ETSU's Rob Pack says those dollars should be used to expand harm reduction programs that prevent the spread of infectious disease from needle sharing. Plus, he says access to medication-assisted treatments like methadone should be improved.
People that have access to medications are much more likely to stay engaged with their treatment services. Over time, their likelihood of relapse is lower.
Frontier Health's Chad Duncan says there's a big need to improve transportation so people can get to and from treatment. He says funds should also be used for more long-term recovery housing.
They may be motivated for change, but the environment they have around them is not as conducive to recovery as what it needs to be in most cases.
Now, both experts I spoke to also emphasized funding for education to address the stigma surrounding addiction and to help prevent the problem for future generations. Josh, Sarah.